think she should be hopping on soon. There we go.
Hi,
Hi.
Funke, how
How
are
are
you?
you? Oh, we share so much history, guys. So
Yes,
I don't even know where to get started. It's just so good to see you. What should we do?
see.
Should we go formal? Should we say Dr. Brown and Dr. Perez or just Sheila and Funke? What do you think?
I'm fine with whatever you like. I'm okay.
Awesome, awesome. All right, good to have you. So I was just starting to just introduce myself and let our guests know that they are in for a blast. Again, I'm Funke Afolabi Brown. I am the founder of Restful Sleep MD, where we help busy professional moms like yourselves and myself prioritize sleep so we can just thrive in this world where there's such struggle, both you and your kids. So Sheila, let's get this party rolling. Tell us a bit about
Definitely.
yourself, and I think I'll let people into a little bit of our history.
Okay. So yeah, my name is Sheila or Dr. Perez-Colon. I'm a pediatric endocrinologist. I was born and raised in San Juan, Puerto Rico. I did my training for pediatric residency and for the fellowship in New York, in Brooklyn, New York. That's where I met you. I have the pleasure of meeting you. We did the residency together, and it was such a blast. And then I stayed there after I graduated as a faculty member for 5 years, which I love. Then life took me to LA for a year. So I worked in LA for 1 year in Kaiser Permanente. And since 2019, I have been here in Miami, Florida. So sunny and beach and having fun. So it's awesome. Um,
Oh,
I, yeah, yeah.
no, sorry, keep going. Sorry, I was just so excited. Just keep going.
No, I was going to say for those of you who don't know what a pediatric endocrinologist does, right? So I'm a doctor from babies from birth, from day one, on up to 21 years old. And what I treat is conditions with hormonal conditions or conditions from the endocrine system. So, for example, your diabetes, short stature, delayed puberty, early puberty, you name it, hypothyroidism, hyperthyroidism. So, any condition in the body that has to be with hormone, I'm the one to see. I'm a pediatric endocrinologist. I will be glad to see you guys.
Awesome, awesome. You heard it, guys. You heard it. So we'll talk a little bit more, probably closer to the end, about how we could just like connect with you with all this work that you do. But we just wanted to get on here and talk a little bit about obesity and sleep. You might wonder what does a sleep a sleep physician have to do with an
Mm-hmm.
endocrinologist? It turns out there's a lot. And
Mm-hmm.
you need to be on earth one day to realize that the obesity pandemic is very prevalent. It's a huge problem now. I mean, it's a sensitive issue for kids and adults as well, because we want people to be able to embrace their bodies, right? But then,
Right.
there are medical pieces to it that we do need to pay attention to as we encourage our children and ourselves to embrace our bodies, and be proud with the bodies we have. We still have to be aware of, okay, what are things that we need to pay attention to? So we really wanted to just get on here, talk a little bit. We're going to try to keep it short and sweet, but I'm sure a couple of you can tell I talk a little, a little bit, but
I
we'll
love
see.
it.
We'll see what we can do. There's just so much to cover, but I
Yeah.
guess we'll just get started. So can you start by just telling us a little bit of just what's the data like now? What's been going on with obesity and kids, and what impact that is having currently?
So definitely we know that obesity is a global epidemic, right? And it has been going on for many years. But unfortunately, since the pandemic, this situation worsened. It got even worse, right? Obesity overall, as you mentioned, Funke, and I love what you say, because it's like a balance. We need to be very careful on how we address that issue with the adolescent, with the child, right? Because we want to make sure that they eat healthy and they are on track, but make sure that we don't take them to the other side, and they have body issues like you mentioned. So we need to be very careful. However, the obesity is a disease, and it's something that we need to understand. And sometimes it's tough to hear, to listen, but we need to recognize it as a disease, because otherwise we just think, he's just obese, she's just obese. It's something like, oh, it's just a characteristic or something. And no, it's a condition. And I always teach my patients and parents to recognize it as a disease. So that way we can think even, pay more attention and really tackle the problem, right? With the pandemic, what happened, Funke, and you for sure saw it as well. It's like patients were staying at home, kids and adolescents, right? They were all virtual. They were not going to school. Their sport and their PE classes were canceled. They were all day in electronic for hours. They were going to bed late, right? So all that lead into worsening of the obesity. So nowadays I see it more and more in clinic. It's a problem that again has been going on for a long time, but definitely during these 2-3 years, it had worsened significantly.
Yeah, and I love what you said. Like, it's a disease actually. It's interesting. Like, now when I have patients that have, sleep issues, right? Adolescents, and they have high blood pressure and diabetes, and we'll talk a little bit about things like that. It's like, wait, am I treating an adult here, or is it a kid? But now our children are developing grown-up diseases. So this is something we do need to address in a way that to motivate us to change, to really start to have those conversations. So I just love how you've broken it down and really just talking through some of the factors that have contributed to an uptake, right? It's almost like a vertical curve right now. It's just going up, and things like that. And and I love what you said, the inactivity, the sleep piece, of course, which, of course I'm invested in, and the diet and things like that. And even in some situations, the neighborhoods, sometimes even when we ask people to get out, they don't feel comfortable stepping out of their neighborhoods. And so, of course, that's where the health disparities piece also comes in. And so it's like we're in this spiral. But I think the first step towards heading in the right direction is starting to have conversations about this. Right. So what about the consequences? Why is it such a big deal? We've talked about, why it's increasing. Now, what are the reasons that we should even be having a conversation about this? Tell us a few of them.
Yeah, no, definitely. So obesity can lead to cardiometabolic conditions, right? Worsening, a simple word is like, it can lead you to pre-diabetes, to diabetes. Type 2, it can lead you to abnormal lipid panel, what we call like dyslipidemia, elevated cholesterol level, for example, can lead to non-alcoholic fatty liver disease, which is something that we see a lot in kids. It's something we were used to see in adults. The same as type 2 diabetes was kind of an adult condition. However, we have been seeing it earlier and earlier. Again, there's so many, high blood pressure, like you mentioned, hypertension for sure, and even depression and anxiety. So definitely, obesity, like I mentioned, we need to start recognizing it as a disease because of the consequence that it can lead to. And Funke, I also love what you mentioned that, we need to be addressing it now. And because we were seeing this disease, when you were an adult, maybe on the 40s, 50s, 60s. I even remember many years ago, like I was like, diabetes type 2 was like of an adult. And no, I see it sadly, but I do see it on 10 years old, very, very often. And it's something that I would love to revert, but we need to educate the population. We need to educate parents. We need to educate patients themselves to, for example, for me, it's like the big important is to eat healthy, right? Make sure that we are showing our kids what is healthy, not to completely not eat, right? Or be, don't eat anything, I'm going to be skipping the meal. No, it's to choose healthy meals. So when these patients or these kids, these children are alone by themselves, they know what to choose, right? So I go over, for example, like portion control, which is very important. Technique for parents, for example, is like if you have, you have been serving, and it happened to me at home, on big plates, move those big plates and then start eating on smaller plates, right? Make sure that we wait 20 minutes after we eat. Sometimes we eat so fast that then we want seconds and even thirds. And no, it takes 20 minutes from when you're full, when you finish eating, for the message to go to the brain and say, I'm full. So wait those 20 minutes, even do a game. I do a game with my daughter, for example. Let's take a look at the clock and let's see 20 minutes after, are you really hungry? If they say yes, I may, okay, maybe it's really was too small of a portion, but most of the time they will say, no, it's fine. I'm really not hungry. Juices, for example, make sure that we decrease the juice and increase water intake, the exercise. There's many things that we can do to help them.
Absolutely, absolutely. Thank you so much. And hopefully I'm saying hi to Dr. Una, who's my mentor and is on. Thanks for stopping by. And if you have any questions, I saw there was one question. I think that would be awesome as well, because we'll definitely love to take questions as this conversation goes on. So one question that just came up now is, can you expound on the non-alcoholic fatty liver disease, which is the NAFLD? But before we take that question, I don't want to forget something you also have said. How about situations where families say, like, we're all big boned in my family. This is what we are. This is how we are. This baby came out 10 pounds. What are you talking about? Like, you know, people just kind of resign, like we're all obese. How do we sort of address that in a way, again, where we're handling this without any shame, without judgment, but really trying to direct them in the right way? Like, you can make changes. You can still make those changes regardless of what the family history is or things like that.
Exactly. No, that I hear is exactly very often in clinic as well. The most important is like, yes, we don't need to follow the pattern, right? Yes, if we have a baby that has, was born with big, right, increase in the weight, for example, there's an increased risk for that patient or that children to be obese in the future. But if this 100%, do we need to follow that? No, right? We can prevent that. How? Recognizing and starting to do changes now. And important, also, for example, if they say, I come from we're a family like have big bones or we're all big, that's, some family, our bodies are different, no doubt, right? But definitely we need to identify what is obesity versus non-obesity, right? And then do the changes as a family. It's very important. And for us, it's a must. For children and adolescents to really make a change, they need to see you guys, the parents. They need to see what you're doing, because you need to lead by example. We cannot say, oh, the juice is for me and for the younger kid, but not for the 10-year-old at home because he's obese. That's actually not fair. That's how I see it. We need to go a step further and say, no, I'm not going to buy juice at home because it's not healthy. And actually, it's not healthy for anyone. Again, it's a balance, because if we want, for example, the vitamin C from the juice, definitely you can offer the fruit itself, or the apple juice, you offer the apple. But we need to do it as a family. Definitely exercise as a family, go and do the grocery as a family, right? Give them autonomy, for example, for them to choose. It's very different just to, the child don't want to eat vegetable, for example, because we just put one there and that's what you're going to eat. Why we don't give them a little bit of a chance and then let's go chopping. These are all the vegetables, show them, and then let them pick, right? And that way, when they go home, they feel like they pick it themselves and they want to try it. So there's definitely ways that we can address that. But no, as a family, we need to do it as a family, and not because we have predisposition mean that we should give up, right? That's very important. We shouldn't give up. The same that comes for type 2 diabetes. You have genetic, right? And for obesity, there's genes for obesity. But would you give up and say, oh, because my parents have diabetes, I'm gonna just leave. I'm not gonna exercise. I'm gonna be drinking all the time juices because I will develop. No. You have the chance to change it around, right? If you acknowledge that you have risk for that, but you make the changes, and most likely you will not develop or later on. But definitely those are the things that we need to, I like to educate, because it's not for certain that you were born a certain way. Definitely you will have it. No, we can change that.
I love it. I love that. So regardless of what history you come with, right? We all come uniquely built. We all have these genes that we don't have control over, but it doesn't have to then define the choices we make moving forward, right? There's some people that, for example, think about like cancer causing genes. The fact that you have a family, you have that inheritance doesn't mean you're like, okay, I guess I'm just going to be doomed to have cancer or whatever, you still make the right choices. You still go for your screening and things. So I love how you brought that analogy. I love it, love it, love it. Okay, so let's bring it closer to home for me. Right?
Tell me.
Sleep and obesity have this complicated meshwork, right? Sleep can impact obesity. Obesity can impact sleep. Can you just unravel that in the beautiful way you always do for me? Listen, people, I've known Sheila for over a decade, and she is like full of so much, and she just like simplifies it. I love it. So let's work your magic for me, Sheila.
Oh my God. Okay. So let's see. So overall, definitely there's a relationship between obesity and sleep. Okay. And it's something we need to have on mind because, for example, for risk factor for obesity, we always think about sedentary life, right? Or poor eating habits. But something that we also need to include that most of the time we forget or we don't give the importance as the other two is sleeping. We need to be sleeping certain amount of hours, and I will go over it, right? For us to be healthy. If we want to go more into biochemical or chemical level, right? That's where I come in, the hormones. So there's different hormones in the body that are very important, for regulation and to be healthy and to be well, right? The most two important hormones that I will go over is one is called leptin and the other is called ghrelin. I don't know, Funke, about those two. I'm going to make it as simple as I can. So, for example, there's a hormone called leptin that is the one that goes to your brain and say, I'm full. Stop eating. I'm not hungry. Okay. Just as simple as that, just to make it simple. The other hormone is called ghrelin, and that's the one that say, I'm hungry. It's for hunger. Okay. So normally, right, we would like that leptin to be higher and that ghrelin to be lower. So we are not as hungry and we are full, and that's fine. What happens when we are sleep deprived? When we're sleep deprived or we're not sleeping the amount of hour that we need, there's an alteration on that ratio, okay? So it turns around, and then what happens? Your leptin goes down, your ghrelin go up. So in simple ways, it's like you're going to be more hungry, okay? So studies have shown through decades, studies have shown that when we don't sleep the amount of hours, next day, for example, and it will be a cascade for days, we will be more hungry, okay? We will be making unhealthy choices. Our brain just go into high calorie food, sweetness, drinks, for example, high carb food, and that's where it all comes out. So definitely sleep deprivation is related to obesity and can lead to obesity. So it's something that we need to tackle. And again, Funke, we don't say it as much. I guess we don't give the importance as we should, right? Because again, we're like, okay, foods and physical activity, definitely that's the most. But what about sleep? We need to start asking, how many hours is my child or adolescent sleeping? Is he just sleeping like 6 hours a night, 4 hours a night? Ideally, roughly, guys, for you guys, it's like, it should be around like 10 to 11. It depends on the ages, but they have a number, just like 8 to 10, right, hours a day. If they're sleeping 6 hours, right, they go late to bed because they are in the screen and they wake up early for school, they don't have enough sleep. So all that will go into a cascade and could lead to obesity. So very important to check that at home and to give the importance as the other two risk factors.
That's it. Honestly, drop mic. That's it. We might as well just call it. Because I love that. And that's one thing I'm like, I'm like the sleep evangelist, right? There are 3 pillars, okay? It's diet, healthy nutrition. It's physical activity. And personally, I feel like sleep forms a bedrock of that. Because guess what? Apart from the dysregulation we have with those hormones is also just the impact sleep deprivation has on your mood, your motivation, and your emotions, right? So think about if you've been deprived of sleep, you've slept 6 hours, right? Who wants to get on a treadmill? Who has the motivation? Who has the motivation? So then you're losing 2 ways. You're seeking high calorie foods, again, because of those hormonal changes. And then you're not exercising. So at the end of the day, when we sleep adequately, again, it varies 8 to 10 hours for teenagers. For adults, it's like 7 to 9 hours. For kids, 9 to 11 if they're in school, school age kids. So if you're not, you can see. And then also the other piece I would say is, remember we talked about some of the inflammation and things like that occur when you're with obesity. With sleep deprivation, you also have like high hormones like cortisol, which is your stress hormone. And so if you have high cortisol long term, it affects your entire system. Hypertension, some of the higher inflammation then puts you at risk if you're obese for diabetes. And so it's just like this vicious cycle. So we're coming back to this. I love this already. I think we're going to be helping so many people, such that when we're approaching this talk about obesity, we're really looking at it from this holistic perspective. The flip side, I'm just going to chime in, and then we'll talk. We need to answer the question on non-alcoholic fatty liver disease. And thank you so much, paging Dr. Mom, for that 100%. It sounds like you agree with us. The sleep disorders can also contribute, can be a consequence of obesity. So one of the most common that we see is sleep apnea. And so unfortunately now we're seeing young children on CPAP, the same CPAP, which is is a machine that kind of pumps air to the back of your throat. That's just the best way. It's like an air stent that you use. So if you have a spouse or you're someone who snores a lot, please make sure you see your doctor, because you might have sleep apnea. If you have sleep apnea, it causes pauses in your breathing during sleep and can affect, it can affect the oxygen you're getting to your lungs, and can also affect your brain function, and can cause a lot of other diseases. If your child snores outside of colds, it's not cute. It might be sleep apnea. So please make sure you seek help. But we're seeing that a lot also with obese children. And, that also, of course, increases that inflammation, increases the risk of all the other diseases that we talked about. So you can see why I feel like it's like this complex mesh. If you don't sleep enough, you're at risk for obesity. If you are obese, you're at risk for sleep disorders. So it's this vicious cycle, Now, we're not prophetesses of doom. We're here to help. So first of all, let's talk about non-alcoholic fatty liver disease. Just a couple of lines on that. I mean, again, guys, we could talk all day about this. You can tell this is Sheila's passion and mine as well.
Yes. So non-alcoholic or fatty liver disease is just when we have increased in weight or obesity, right? There's some infiltration of the fatty cells or the adipocytes, and it get affected into the liver. So that's how simple I explain it to kids, because I see a lot of kids with non-alcoholic fatty liver, and what happened, it will be damaging the function of the liver, right? And then you have the consequence of a liver not functioning. So definitely we want to prevent that. In terms of treatment, how do we diagnose? We can have an idea by doing some liver enzymes on the blood. It may be increased, and then we'll see, there could be fatty liver, there could be an infection, there could be so many things. But then we order a sonogram, right? We do an abdominal sonogram to take a look, and that's how we will see it. If we need to go further there, then we involve the gastroenterologist, the GI, and we will work together. But overall, as simplistic as possible to make sure we understand, it's yes, we have increasing weight, we have increasing fat or adipocyte, and it starts to go in other places, and it's also will go into your liver and affect the liver function.
Yep, that's it. That is so true. So yes, thank you. So patient Dr. Mom mentioned the cortisol level. It's both, right? It increases with sleep deprivation or sleep disorders. It increases with obesity. So this is really a very complex system that we really want to avoid in children that are so young. And Mariel, thank you so much. Mental health. Yes, we're not even delved into that. So, kids with obesity are getting bullied, right? There's a higher rate of mental illness, depression, anxiety, just feeling isolated. That also can impact their sleep, right? So a child whose mind is so full and has had this negative experiences is not likely to sleep well. And so they don't sleep well, but we're back to square one again. So again, it's a very critical and very important set of disorders that we definitely need to address. Okay, so there is hope at the end of the tunnel. That's why we're here. What can we do? How can we, we're starting to have these conversations, which I love, but what are practical things that we can start to do to address just this obesity pandemic as caregivers, as health providers, as siblings, as aunties? What can we do?
There was a delay. So overall, what can we do? that's what can we do? So we should start at home, right? We should start at home. We should start recognizing and not ignoring, right, that we have a problem with obesity, that we're dealing with obesity in kids, obesity, or being, you know, sometimes, at least even I recall in my family when we were young, it's like the chubby we were, the healthier we were. And that belief, those are cultural beliefs that we really need to change. And it happened to most of us, right? Nowadays, not. We want to be healthy. We want to make sure we have the nutrients and that are important, but to eat in a normal way, right? Not too much. In terms of at home, definitely recognize this. Go to your pediatrician, go to your doctor. Let's make sure that we do the weight, do the height, do the test. For example, with obesity, you know, definitely it could be exogenous. It could be like we are eating too much or we're having sedentary life, but let's make sure that we are ruling out, meaning make sure we don't have other conditions. You know, they will send to me, for example, to an endocrinologist if there's any thyroid problem. For example, hypothyroidism could be associated with obesity, right? So we want to make sure the child doesn't have that. And many other things. For example, obesity is associated with decreasing, well, sleep deprivation, right? Kind of is associated with decreasing growth hormone secretion. And as you mentioned, with increased cortisol level. Cortisol is a hormone that is very important for survival, actually to be healthy overall, has many functions, also to normalize kind of the sugar level. Normal cortisol should be high in the morning, but then during the day, it should be going down. When we don't sleep or when we're sleep deprived and in obesity, that cortisol may stay high, even in the evening, for example. And that will lead to, for example, some glucose abnormality, and it will lead to insulin resistance and even to diabetes type 2. So again, to recognize them at home, please make changes as a family. Make sure that they are getting physical activity. This is something that I really, really would like you guys to take from today. We need to move. Okay, we don't need to be paying a gym for a kid or an adolescent. We need to be doing it at least at home. They should be getting around 60 minutes a day. Sometimes, you know, from my patients, I always hear, I don't have time, I'm very busy, I'm on this and that, I'm from college. But yeah, you can break it down. If you want to do 15 minutes now, and in 3 hours do another 15 minutes and another 15 minutes, that's fine. But should be 60 minutes. But there's no excuse that I cannot go to the gym. No, you can go up, down the stairs, or put your app and do some exercise. We need to be moving. And also, please make sure that you're looking what you're eating. You know, make sure, is this healthy or not? Healthy, we need to eat on a balance. We should have proteins, for example, our meat, our fish, for example, our chicken. We need to have vegetables, and we can have some carbs. When we have carbs, the important is like we need to be cautious with it. Make sure it's just a handful. For example, if we're going to be eating rice, it's just a handful of rice or pasta. Be careful with bread. Very important, and it's something that kids always and adolescents ask me, what is the difference, you know, between brown bread, for example, like whole grain, and just the white one? It's like it has fiber. Anything that has fiber, it kind of helps us take the sugar out of the system, right? So anything that has fiber will make sure that our sugar doesn't go as high right after eating. So for example, fruits, which one are better? So those that ends in berries, I always say berries, raspberry, blueberries, whatever, strawberries, those have less sugar and has more fiber. So that sugars get kind of the fiber trap the sugar and will go out of the system. Make sure they don't eat late, Funke. Very important is, and it's important, I know there's some debate, does that has to do with obesity or not? Yes, it does, right? Number one, they should be eating. You know, sometimes they have dinner at 6 and then at 10 p.m. they go to the fridge and they're having snack. They're not moving at that time. They're going to be sedentary. Physical activity is low. And then if you have high glycemic index or high content of food with sugar, definitely that will spike your insulin level, and all night you will have it high. So we need to make some changes. We should start slowly. We don't need to do it all at the same time, but slowly, one step at a time. Let's go shopping this week together and let's see what we can do. And like that, but we need to have a plan. We need to tackle this obesity problem from today.
Oh, that is so, so good. Yes. And I love what you said about doing it as a family, right? So if we're all going to cut back on the juices, we can't tell our child who's on the heavier side not to drink juice, and then the others can drink juice. It's not fair.
And that happens, exactly. And that happens a lot. And they don't, and actually what I have got from my patients and from parents is like, they don't make it, it's not purposely, right? It's that they say, I'm not obese, so they are obese. Why? we should be changing, you know, cutting the juices, but juices are not good for anyone overall. So, you know, and we need to help that child at home. And yeah, bullying is a big problem. We need to be open with our kids. We need to talk to them to see if bullying is happening. We need to please get help. We have seen many consequences just because of obesity bullying, which is very sad. Let's open conversation. Like, let's start talking about it, and let's make sure we take action.
Yes, yes. The mental health piece is huge. So we cannot disregard it. We need to pay attention to all these factors. And also, of course, make sure they get enough sleep and, you know, the right number of hours of sleep. If you're concerned about, hi, sweet Dr. Penny, if you're concerned about an underlying sleep disorder, then you should speak with their doctor just to make sure that they're referred either for a sleep test to make sure they don't have sleep apnea, or, you know, or that, you know, they don't have any underlying issue that may be contributing to sleep. This is incredible, Sheila. This is way, way beyond. It's incredible. So how do we like connect with you? How do we get to work with you? What's going on? How do we find you? All that good stuff.
Well, right now I'm working in Miami, right? So you guys can, my professional kind of page on Instagram is Direct Peds Endocrine. So you guys can always, you know, contact me through there. I always respond to your message. All right. I work in a private clinic here in Miami. So you can always call to make an appointment. And I'm also going to be working very, very soon at Puerto Rico as well, in Puerto Rico. So I'm going to be working Miami and Puerto Rico, which I'm super excited about it.
Oh, that is so, so good. We're looking forward to it. So I'll put that in as well. Please, definitely Direct Peds Endocrine is where to follow. Restful Sleep MD, you're on here already. Just click the link, follow if you're not. And yeah, we'll see you. I hope this has been valuable to everyone that's watching live. Thank you so much for hanging out with us. If you're watching the replay, you could just put in here what's one takeaway, what's one action step you're going to take. Is it going to be to put a reminder on your phone to, you know, move for 15 minutes, like Sheila said, up and down the steps? Is it going to be to walk outside? The weather is turning and it's becoming really, really nice outside since we're not in Miami. So but in Pennsylvania, it's nice outside. So you could get out there and just keep moving. Is that what you're committing to? Are you committing to saying we're going to switch out, we're going to go shopping to do groceries together so we can pick, you know, real healthy items? Yes. Are we going to set an alarm or something, a reminder that it's time for bed? We're going to put the devices away and we're going to all start heading to bed to start our bedtime routine. Whatever that is that you're taking away, let's start to take action today. Sheila, this has been wonderful. Thank you so much.
Thank you, Funke. This was awesome. We could be talking forever. You know, there's a lot to talk about it.
I know.
But yeah, we can meet another time and then continue the chat.
Absolutely. Absolutely. Bye, everyone. And happy Mother's Day to the moms out there.
To you, happy Mother's Day, and to everyone who's watching.
Sheila. All right.
Thank you.
Bye.
Bye-bye. Take care.
Bye.
Thank you.
Take care.
Bye.